Welcome to the another series of the pathology discussions. So today the topic of my discussion will be about leprosy. So leprosy, it is a chronic granulomatous disease which is afflicting many individuals in the different parts of Southeast Asia, Africa, and it is caused by the bacteria Mycobacterium leprae. It is a chronic granulomatous disease, and the source of infection of this disease is particularly in close contact with the patients of leprosy, and it can also be seen it can also be transmitted with nasal discharge. So, viewers and students out there, I would like to tell you that leprosy, the incubation period for the Mycobacterium leprae is quite long, and the only source of infection is the close contact with the patients. So, the infection usually spreads whenever there is a close contact with the patients or through the nasal discharge of the patient. It is mostly found that the Mycobacterium leprae has a strong affinity for the colder areas of the body. So the Mycobacterium leprae thrives well in the colder areas of the body. So it has a strong affinity for the skin, the peripheral nerves, the skin and the peripheral nerves. These are the most common, and the nasal discharge. These are the most preferential sites for the Mycobacterium leprae to thrive. So the leprosy can be divided into four types. One is the lepromatous leprosy. The second variety is the tuberculoid leprosy. The third is the dimorphic leprosy. And the fourth is the indeterminate leprosy. So today's topic of my discussion is about the differentiation between the two important types of leprosy, that is the lepromatous leprosy and the tuberculoid leprosy. Now students, the points of differentiation I have categorized, and this is a very famous and a very common question in all the competitive NEET exams, or wherever the medical exams are in various kinds of medical NEET entrance, or the entrances for the PSCs and everything. So this is a very common, very famous questions as to how the students can answer this, and this is quite a very bit confusing. So I have made the differentiation very clear. So moving on to the differentiation, starting with, so the lepromatous leprosy, it is found that there occurs multiple hypopigmented nodular lesions are found. Alright, so in the lepromatous leprosy, there occurs multiple hypopigmented nodular lesions, and the characteristic distinguishing feature is the presence of leonine faces. So the patients are going to have lion-like faces. The skin becomes rough, rugged, and the faces of the patients become like lion. Now, in the tuberculoid leprosy, there occurs asymmetrical few. As compared to the lepromatous, there were multiple. In case of tuberculoid leprosy, there occurs only few and erythematous nodular lesions. So, in the tuberculoid leprosy, the lesions are of a much red in color. They are erythematous. They are having a much darker red color as compared to the lepromatous leprosy. Moving on to the second point. So I have already told you that the Mycobacterium leprae bacteria has high affinity for the peripheral nerves. So here, in the case of lepromatous leprosy, less severe nerve involvement is there. So nerve involvement in case of lepromatous leprosy is less, whereas in tuberculoid leprosy, distinct sensory disturbance can occur. So sensory disturbances can be seen. So the patients, they are going to have a certain kinds of sensory disturbances can be seen in the different parts affecting the wherever the Mycobacterium leprae is thriving. Now the third point of differentiation is the collection of foamy macrophages, lepra cells or the varicose cells are found in case of lepromatous leprosy, whereas in the case of tuberculoid leprosy, there is a formation of a hard tubercle which is similar to the granulomatous lesions. So students out there, here there is collection of the foamy macrophages, lepra cells or varicose cells in lepromatous leprosy, whereas in case of tuberculoid leprosy, hard tubercle similar to granulomatous lesions are seen. Moving on to the fourth point of differentiation. The fourth point of differentiation is that on looking at the cellular, when we have the skin sections, when looking at the skin sections under histopathology, what do we find? The histopathological findings include that there is a presence of a clear zone over here. in case of lepromatous leprosy, a clear, distinct clear zone between the epidermis and dermis is found in case of lepromatous leprosy, whereas in the case of tuberculoid leprosy, there is no such clear zone between the epidermis and dermis. Moving on to the fifth. Now, already I have told you that the Mycobacterium leprae is a bacilli. It is a rod-shaped bacteria. So the lepromatous leprosy, the bacteria or the bacilli, the bacilli are seen in the form of globi, or they show a characteristic pattern of a cigarette in a packet appearance. So it's a very famous and a very most commonly asked MCQ in multiple choice questions that is very commonly asked as to cigarette in a packet appearance is seen in cases of lepromatous leprosy, whereas in cases of tuberculoid leprosy, few bacilli in granular or beaded form is present. Now, the next point of differentiation, very important students out there, lepromatous leprosy, the test, what is negative here is the lepromean test. So the lepromean test, the L of the lepromatous leprosy and the L of the lepromean test, students don't get confused. Students get confused because the lepromean test, they write positive in lepromatous leprosy, but it is incorrect. So the lepromean test is negative in case of lepromatous leprosy, whereas in the case of tuberculoid leprosy, a positive lepromean test can be seen. The last and the very important point of that, not the least point of differentiation, is that lepromatous leprosy develops in patients who are having an absent or deficient cell-mediated immunity. All right, the patients who have either absent or deficient cell-mediated immunity, they show lepromatous leprosy, whereas in case of tuberculoid leprosy, the cell-mediated immunity of the patient is either adequate or high. So viewers out there, this was my differentiation, this was my analysis as to how we can very easily differentiate between the two forms of leprosy, that is the lepromatous and the tuberculoid leprosy. Students, if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated about the newer videos. Thank you for watching.